Good morning everyone. Today I am here to present my student research project which was about detection of clinically inapparent dengue infection among the patients who were presented to Kandy Virology Laboratory for infective screening. Dengue. As all you know, that is one of most prevalent mosquito-borne viral infection in human. It reported in tropical and subtropical countries like Sri Lanka. Most of the time, we discuss and take measures to control this viral infection while considering only symptomatic people. It means the people who show the clinical signs after the infection. But at the same time, we forget the people who get infected but they didn't show the clinical signs. Those people we known as asymptomatic people. Recently, there are many studies has focused about these asymptomatic patients and their role in the world, especially in endemic countries. In my study, main objective is to determine the proportion of dengue-infected afebrile patients among the people who were presented to the virology laboratory of the Kandy Teaching Hospital for infective screening. This was a prospective study which was done from 1st August 2019 to 30th September 2019. This is the period of beginning dengue outbreak just after monsoon rainy season. Study population was comprised with 100 consecutive samples which were received to Kandy Virology Laboratory for infective screening against hepatitis B, hepatitis C and immunity against hepatitis B. At the time of collecting these samples, all the patients were afebrile. This study was performed at Virology Laboratory at the Kandy Teaching Hospital. All the samples tested for dengue NS1 antigen in order to detect the early mark of dengue infection. For this purpose, we use Patelia NS1 antigen ELISA kit, which is a one-step sandwich ELISA. Test procedure was done according to the manufacturer instructions. Samples and control were directly and simultaneously incubated with conjugate for 90 minutes at 37 degrees in microplate wells. Those microplate wells were well sensitized with murine monoclonal antibody. If NS1 antigen present in samples, they will form immune complex with those murine monoclonal antibodies. After the washing step, chromogenic solution was added. If immune complexes have formed in those wells, those wells show blue colorations in here. After 30-minute incubating period, stop-in solution was added. Then stop the further reaction. Finally, optical density values were obtained using spectrophotometer. Results. Demographic data was obtained using laboratory records of the patients. In 100 samples, there were 49 females and 47 males. And also there were 4 samples, their laboratory records did not indicate their gender information. Already I said about the study population contained with patients, but they are not dengue patients, but they belong to different patient category. I have mentioned here those patient categories. I have to conduct 2 ELISA assays to complete all the 100 samples. In here, I have demonstrated final ELISA plate. In first image, demonstrate the first ELISA assay after stop-in solution was added. This ELISA contained first 50 samples. Then second image demonstrate the second 50 samples. In first image contained first 50 samples. Among those 50 samples, there were three positive samples. It means those cells contain NS1 antigen. Then I repeated those three samples with second ELISA assay. Then this time also gives same color changes. Sample ratio was calculated according to the manufacturer recommendation. Sample ratio was determined with optical density value of samples divided by cutoff value. If sample ratio less than 0.5, those samples be considered as negative samples. Sample ratio between 0.5 to 1, those samples be considered as equal. The samples ratio was more than 1. Those samples we considered as positive sample. I already showed that color changes after the ELISA procedure was done. There were 3 samples, they show the color changes. Those 3 samples, sample ratio was more than 1. It means those samples contain NS1 antigen. Among the 100 samples, there were 3 samples with NS1 positive antigen. Discussion. Recently, there are many studies has pointed out the role of asymptomatic infection in society. Those peoples are infectious to mosquitoes. That has proved by some scientific research. And also, these people have contributing dengue outbreak. Some atypical contamination, it means during blood transfusion, bone marrow transplantation, like situation, provide opportunities to these patients to introduce this dengue infection to another person. As also, these asymptomatic patients are highly susceptible to getting secondary diseases which can lead to dengue hemorrhagic fever. Therefore, very important to identify this asymptomatic population in the society. It's similar to iceberg theory. We can only see the symptomatic people. But actually in society, there are many asymptomatic people than symptomatic patients. Therefore, we can get a complete picture of dengue epidemics by considering these asymptomatic population as well. Therefore, when we take measures to control this dengue epidemic, we must consider about those asymptomatic peoples also. In conclusion, this study provides some evidence there are people with infected dengue infection, but they didn't show the clinical signs. It means there are people with asymptomatic carriers, asymptomatic patients. Therefore, we have to take a more extensive control effort to reduce the exposure and transmission from dengue from this kind of asymptomatic patients. This study was done with 100 samples only, but if we need to get a better idea of asymptomatic population in Sri Lanka, we have to conduct a study with large population. It means island-wide. And also, as a government, we have to establish some method to screening those asymptomatic peoples. Thank you.